Hi, I'm Dr. Nicole Rogers, a hair transplant surgeon and board-certified dermatologist in New Orleans, Louisiana. Recently, a reporter contacted me to ask for my comments on Ricki Lake. As many of you know, this very brave actress recently came out explaining how she had been suffering for hair loss for many years, and she had done all she could to hide it, to cover it up, to tease it, to wear wigs, to wear hats, and finally she decided to shave her head and enjoy the freedom of going without any kind of camouflage or cover-up.
Former talk show host and actor Ricki Lake is embracing her own beauty after opening up about the struggles she faced during what she says is her 30-year hair loss journey. It has been debilitating, embarrassing, painful, scary, depressing, lonely, all the things. There have been a few times where I have even felt suicidal over it. I know that by sharing my truth, I will be striking a chord with so many men and women.
This was personal. This wasn't about, I'm overwhelmed by the reaction. I was really scared people were going to say mean things. You know, I was really, I was sort of at the end of my rope. This has been something that has plagued me for so long. It was my secret, you know? It's like, and I'm an open book. You guys grew up with me. The weight fluctuations, the messing with my hormones, it all contributed. Plus genetics and birth control, hormonal birth control. All of it was like a perfect storm.
Unfortunately, her circumstance is not that uncommon. We know that 40 to 50% of women in the US and around the world can suffer from hair loss. And in fact, the incidence of hair thinning in women is just as common as it is in men. What can women do about it? In her case, obviously, there were a lot of factors that went into it. For most women, thinning comes on very gradually over the years. It can present as early as the teens, especially if it's inherited from mom or dad. I've had many patients tell me their father lost all his hair in college and their twin sister maybe wears a wig. And so you know in those cases there's a strong family history of hair loss, and what we call in that case is genetic or female pattern hair thinning. The other term is androgenetic alopecia. In other situations, the hair thinning may just be very temporary, either as a result of having a baby, what we call telogen effluvium, or there may be some underlying nutritional abnormality. The labs that I check most frequently for women are things like vitamin D, ferritin, which is a measure of your iron stores, zinc, and also TSH, which is an indicator of your thyroid function. For many women, hypo or hyperthyroidism is very common, so there can be a number of confounding factors. Ricki Lake, if you're listening, I'd be happy to visit with you. If you are interested in coming to New Orleans, I promise we'll take good care of you and welcome you to our clinic.